Why don't all rotator cuff repairs heal? As a surgeon, I would like to believe that if I do the surgery correctly, that the tendon should always heal and that patients should recover their full function. However, I've been doing this long enough that I know that is not always the case. We can do all sorts of technical wizardry and create very strong repairs, but ultimately, the body has to reconnect the tendon to the bone or the repair will fail. Welcome to the Shoulder and Arm Health channel, where we discuss the latest and best in shoulder and arm health. The ROHI score was introduced several years ago to help predict healing after a rotator cuff repair. Researchers found that certain factors affect your ability to heal after a rotator cuff repair. The factors on the scorecard include age, the size of the tendon tear, the presence or absence of muscle atrophy, the strenuousness of your work activities, and your bone density. So why did these factors matter in rotator cuff repairs? By the way, if you keep watching, I will show you how to calculate your ROHI score. Also, I'll tell you about some options you may want to consider if your rotator cuff healing score is low. So let's break down each of the factors on the ROHI score. Let's start with age. If someone is above the age of 70, this predicts lower healing. Now, although your age is just a number, it is hard to escape the effects of age on the body. As you get over the age of 70, circulation and healing potential can be reduced. Tear size and retraction. The size of the rotator cuff tear often also predicts repairability. Size and retraction go together in that the larger the tear, the more the tendon will retract further back into the shoulder. This affects repairability in that during surgery, the surgeon often has to fight against the scarred tendon to get it to come back to its normal position. Scar tissue and muscle tension can lead to gaps at the tendon and bone interface. This can lead to failure of the repair. Atrophy. If the muscle has atrophy, that is also a strong indicator that the tear has a chronic damage component and it's less likely to heal. In other words, the longer a tear has been present, the more the muscle shrinks and atrophies away. Reconnecting an atrophied muscle is challenging due to the increased tension. Also, the muscle is less able to do its job even if it is connected and heals again. Tear size and muscle atrophy are best seen on an MRI. Although it may not be obvious, low bone density can affect rotator cuff healing. This may be due to the fact that we use bone anchors to connect the tendon back to the bone. If the bone is weak or osteoporotic, an anchor can pull right out of the bone, leading to failure of the repair. On the flip side, if you have good bone density, it predicts a more successful healing result. It also makes sense that if you have a very strenuous job, that you're more likely to have an issue with the tendon healing. If you want to calculate your ROHI score, I've placed a link for this interactive calculator below. You can enter your details and it will tell you the likelihood of a successful rotator cuff repair. Now, one thing to be aware of is that it may ask you for some details that you might not have the answer for. For example, it will want you to enter your bone mineral density and the presence or absence of muscle atrophy as seen on an MRI. So you may need to ask your doctor to order a bone density test, or if you have one, you may have to look it up on that report. But otherwise, if you're under the age of 55, it may be safe to assume that your bone density is normal, which is greater than minus 2.5 standard deviations. Answers to the questions about how retracted or how much atrophy is present may be found in an MRI report, or you may ask your shoulder surgeon. So as I promised, I'm going to show you how to calculate your own ROHI score. So if you go to this linked web page here and click on this button here, it'll launch the ROHI calculator. So you can see there's a lot of different factors here that you can input based on your actual data. So if you're younger than 70, you would select that. And based on the size of the tear, you may have to ask your shoulder doctor, or you can refer to the MRI report sometimes to get these answers. But if it's a fairly small tear, let's just put in that scenario, and there's not much infiltration, and let's say you do a medium level of work, that's kind of subjective, and that your bone density is greater than minus 2.5. Let's say that's kind of the better scenario. You want to have good bone density. And so if you calculate this, you can see here now the chance of healing is 94%. That's a very good result. But you can quickly start to see that if you change some of these parameters, let's say that I'm over 70 and the tear size is fairly big and there's some retraction and there is some infiltration of fat into the muscle. That's called the Goutallier classification. You can find that sometimes on your MRI report. And let's just keep that at medium, and let's say that I do have some osteoporosis, so my bone density is less than minus 2.5. If you recalculate it here, you can see that the chance of healing goes down to 14%. That's a significant drop. So obviously you want to use as much as possible with your own numbers, and if there are some gaps, like you don't actually have the information that it's asking for, you may be able to just kind of play with these. Like if you don't know your bone density and you're let's say that you're less than 55 or younger than that, you can probably assume that this number is, greater than minus 2.5. You can see that in some cases of large tears in those who are 70 or older, the failure rate is nearly 90%. So why even try in these cases? Well, in some cases, we may actually decide not to try to repair the tendon due to the high risk of failure. But in most cases, the success rate is still quite good. In people with more risk factors for failure, though, we may elect to use some of the new technology that is available today. These include collagen or dermal augmentation patches, as well as bone marrow aspirate concentrate, also known as BMAC. Augmentation patches and BMAC have been shown in studies to improve the healing rates when used in conjunction with a rotator cuff repair. BMAC is one of the few ways we have available in the United States to give stem cells. The natural healing factors in bone marrow can be directed towards stimulating the tendon to grow more robust roots into the bone. One study compared a group of patients who had BMAC with their rotator cuff repair and to a group that didn't have the BMAC. The group who got the bone marrow concentrate had no failures at the 6-month mark, compared to 1/3 of the patients in the non-treated group. And at the 10-year mark after surgery, 87% of those treated with BMAC had intact tendon repairs, while more than half of the non-treated group had retorn. So this study highlights the potential of BMAC to stimulate strong healing of the tendon, both for now and for the future. I've actually made a previous video on this subject, and I'll put links for that in the description below. Some tendons aren't just torn and retracted, however. They can be really challenging because they're also thinned out due to chronic abrasions on the tendon. In those cases, I prefer to use a dermal allograft or a collagen patch, which can add thickness to the tendon. Early results seem to be promising for these types of patches to help the tendon heal as well. Thanks to these new options, we can get even difficult rotator cuff tears to heal. This isn't to say that we should ignore the ROHI score. In fact, I think the ROHI score is a great place to start. It's a good tool to help us decide if we should attempt the repair or if another type of surgery would be a better option. Thanks for watching. For more about the latest and best in shoulder and arm health, please subscribe and share this video with anyone who might benefit from this information. Thanks, and I'll see you in the next video.